Imagine walking into clinic and seeing 5 different patients with depression. Surprisingly, all 5 of them might benefit from psychotherapy, but not necessarily the same psychotherapy. So how do you know which one to choose? Should you explore unconscious conflicts, focus on relationships, change behaviors, challenge negative thoughts, or simply help someone cope with what they're going through today? At first, psychotherapy can feel like one giant list of therapies to memorize. But I don't think that's the best way to learn it. Because psychotherapy isn't really about memorizing names. It's about understanding what each therapy is trying to change. And once you understand that, everything starts to click. So throughout this video, I want you to keep coming back to one simple question. What is this therapy trying to change? If you can answer that question, you can usually figure out why that therapy exists, when it's used, and how it's different from the others. Let's see what I mean. Think about a patient who repeatedly finds themselves in unhealthy relationships but can't explain why. They know the pattern. They want it to stop. Yet somehow, they keep ending up in the same place. Psychoanalysis asks a very different question than most other therapies. Instead of asking, how do we change this behavior? It asks, what unconscious conflict is driving this behavior? Developed by Sigmund Freud, psychoanalysis is built on the idea that many of our thoughts, emotions, and behaviors are influenced by unconscious conflicts, often rooted in childhood. The goal isn't simply symptom relief, it's insight. Traditional psychoanalysis is intensive, often involving multiple sessions each week over several years. During treatment, patients freely discuss whatever comes to mind through free association, allowing unconscious thoughts to gradually surface. Along the way, you'll hear several important terms. Transference is when patients project feelings from important people in their past onto the therapist. Countertransference describes the therapist's emotional reactions toward the patient. Resistance refers to unconscious defenses that interfere with treatment. Over the years, psychoanalysis evolved into newer forms such as ego psychology, object relations theory, and self-psychology, but they all share the same basic goal: understanding the unconscious mind. So if you only remember one thing, remember what psychoanalysis is trying to change: insight into the unconscious. Now, not every patient needs years of therapy. Sometimes people simply need help understanding patterns that are affecting their life today. That's where insight-oriented psychotherapy comes in. Like psychoanalysis, it still asks why someone feels the way they do, but it's shorter, more practical, and more focused on current problems and relationships. Imagine someone struggling after losing a job. Rather than spending years exploring childhood, therapy focuses on understanding the emotional patterns surrounding that specific life event while helping the patient move forward. The question here is, what patterns can I better understand? Now let's shift our attention in a different direction. What if the biggest problem isn't happening inside the mind, but between people? That's where interpersonal therapy comes in. Imagine someone whose depression began shortly after a difficult divorce. Instead of analyzing childhood experiences, interpersonal therapy helps that person work through grief, improve communication, navigate life transitions, and strengthen relationships. It's especially useful for depression because healthy relationships often play an important role in recovery. The question interpersonal therapy asks is, how are your relationships affecting your mental health? But not every patient needs deep psychological insight. Sometimes, they simply need help getting through today. That's where supportive therapy comes in. Supportive therapy focuses on building resilience, reinforcing strengths, and improving coping skills. Imagine a patient with schizophrenia who becomes overwhelmed by daily stress. Rather than exploring unconscious conflicts, the therapist provides encouragement, reassurance, structure, and practical problem-solving to help the patient function more successfully. Its question is simple: how can I cope better today? Everything we've discussed so far has focused primarily on understanding emotions and relationships. But what if understanding isn't enough? What if the goal is simply changing behavior? That's where behavioral therapy comes in. Behavioral therapy is based on one simple principle. Behaviors are learned. And if behaviors can be learned, they can also be changed. Imagine someone with a severe fear of dogs. Behavioral therapy isn't asking why they're afraid. It's asking, how do we retrain this response? One approach is systematic desensitization, where exposure happens gradually while practicing relaxation techniques. Another is flooding, where the patient confronts the feared situation directly until anxiety naturally decreases. Behavior therapists also use positive reinforcement, such as token economies, to encourage healthy behaviors. You'll also hear about eye movement desensitization and reprocessing, or EMDR, for post-traumatic stress disorder, and dialectical behavior therapy, or DBT, which combines behavioral principles with mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. It's especially effective for borderline personality disorder. Another interesting behavioral technique is biofeedback. Using electronic monitoring, patients learn to control body functions that usually happen automatically, such as heart rate, muscle tension, or breathing. Biofeedback has been used to help conditions like migraines, hypertension, asthma, and chronic pain. But changing behavior isn't the only way to help people improve. Sometimes the biggest obstacle isn't what someone is doing, it's what they're thinking. That's the foundation of cognitive behavioral therapy, or CBT. Imagine two students who both fail the exact same exam. One thinks, that was rough. I'll study differently next time. The other immediately thinks, I'm a failure. I'll never become a doctor. Same event. Completely different thoughts. Completely different emotional responses. CBT teaches that our thoughts, emotions, and behaviors constantly influence one another. It teaches patients to recognize distorted thought patterns, challenge them with evidence, and replace them with healthier ways of thinking. One of the highest yield concepts is Beck's cognitive triad: negative views of yourself, the world, and the future. CBT is structured, goal-oriented, and often includes homework because the ultimate goal is helping patients become their own therapists. Its question is, what thoughts can I change? Therapy also doesn't always happen individually. Sometimes, healing happens together. Group therapy brings together people facing similar challenges. One of its greatest strengths is something called universality, the realization that you're not alone. Simply hearing someone else describe the same struggle can reduce shame while providing encouragement, accountability, and opportunities to learn from others. And finally, let's zoom out. Sometimes the problem isn't just one individual. Sometimes it's the entire relationship system. Family therapy views the family as an interconnected unit, focusing on communication, roles, boundaries, and interaction patterns. Couples therapy focuses on strengthening communication, resolving conflict, rebuilding trust, and improving emotional connection between partners. Rather than asking who is right or wrong, these therapies ask, how can this relationship function more effectively? So, what should you remember from today's video? Don't think of psychotherapy as one treatment. Think of it as a toolbox. Each therapy has a different purpose. Psychoanalysis asks, why do I feel this way? Insight-oriented therapy asks, what patterns can I better understand? Interpersonal therapy asks, how are my relationships affecting me? Supportive therapy asks, how can I cope better today? Behavioral therapy asks, what behaviors can I change? CBT asks, what thoughts can I change? Group therapy reminds us that healing often happens together. And family and couples therapy ask, how can this relationship become healthier? So the next time you're trying to remember the type of psychotherapy, don't start by asking what it's called. Start by asking, what is this therapy trying to change? Because once you can answer that question, everything else starts to make sense. In the next video, we'll take a deeper dive into psychoanalysis, exploring the unconscious mind, free association, transference, countertransference, resistance, and the key concepts you need to know for your exams. and for real clinical practice. If you found this video helpful, don't forget to like, comment, and subscribe for more high-yield medical education made simple. Until next time, keep learning, keep growing, and keep expanding your horizons.